So now let's proceed to the health literacy system and practice. So first, let's define what is a healthcare system. So a healthcare system is the organization of people, institutions, and resources that deliver healthcare services to meet the health needs of target populations. It is also the sum total of all the organizations, institutions, and resources whose primary purpose is to improve health. So, in some countries, health system planning is distributed among market participants, and in other, there is a concerted effort among governments, trade unions, charities, religious organizations, or other coordinated bodies to deliver planned healthcare services targeted to the population deserved. Also, a health system needs staff, funds, information, supplies, transport, communications, and overall guidance and direction. And it needs to provide services that are responsive and financially fair while treating people decently. According to the World Health Organization, the directing and coordinating authority for health within the United Nations system, healthcare system's goals are good health for the citizens, responsiveness to the expectations of the population, and fair means of funding operations. Progress towards them depends on how systems carry out four vital functions: provision of healthcare services, resource generation, financing, and also stewardship. So there are 5 primary methods of funding health systems. The first one is the general taxation to the state, country, or the municipality. The second one is the national health insurance. The third one is the voluntary or private health insurance. The fourth one is the out-of-pocket payments, and the last one is the donations to charities. The management of any health system is typically directed through a set of policies and plans adopted by the government, private sector business, and other groups in areas such as personal health care delivery and financing, pharmaceuticals, health human resources, and public health. Also, the World Health Organization supports that an increase in effective services to all people in need, including service delivery management and support, improved patient safety, efficacy of services, and financial protection. Also, increased efficiency and building of financial, human, institutional, and knowledge capacities. Also, should be coordinated, participatory, and accountable policy formulation, and implementation. Now let's talk about the healthcare system in the Philippines. So the healthcare system in the Philippines is considered to be of good quality by international standards. As such, all Filipino citizens are entitled to free medical care through the Philippine Health Insurance Corporation, known as the PhilHealth. And in early 2019, the country reached a major milestones with the Universal Health Act. After that, the scope of PhilHealth's coverage expanded to include free medical consultations and laboratory tests. Furthermore, going forward, all Filipino citizens will be automatically enrolled in the national program. And also in the country, the private and the public sectors are intertwined. Many aspects of services are delivered through health management organizations or the HMO. Most employees in the Philippines are enrolled in an HMO through their employer's benefits package. PhilHealth and HMO are two systems that work well together, with HMOs covering costs not included with the PhilHealth plan. So how the healthcare system in the Philippines is funded? So the PhilHealth program was set up in 1995 to provide affordable universal coverage, PhilHealth is government-controlled and funded. It is financed by local and national government subsidies as well as through contributions by employers and employees. So moreover, the program offers various medical plans depending on income, age, and circumstance. The PhilHealth has 6 major membership categories, and they are the formal sector, which workers employed by public and private companies. The second one is those indigent, which is the impoverished people subsidized by the National Household Targeting System for Poverty Reduction. As such, this category includes people who have no visible means of income and whose income is insufficient for subsistence. The next one is the sponsored members, those people subsidized by their local governments. The next one is the lifetime members. It is the retirees and pensioners who have already paid premiums for at least 120 months and are over 60 years old. These are non-paying members. The next one is the senior citizens, a category under certain set of regulations under RA 10645 that offers free PhilHealth coverage to those 60 years old. However, this is not the same as lifetime members. It just applies to seniors not currently covered by any of the existing membership categories of the PhilHealth. So, and the last one is the informal economy, which primarily self-employed people, migrant workers, and those who do not neatly fit within the formal sector category. So, in other words, it is a favorite among expats. Now let's proceed to the healthcare literacy practice. Healthcare literacy practices they used with their patients to assist them in understanding their health conditions, treatment options, and treatment plans. There are 5 categories of these practices. The first one is the collaborative practice, which is communication sharing and problem solving between the physician and nurse as peers. So this pattern of practice also implies a shared responsibility and accountability for patient care. The next one is the differentiated practice, which is the use of nursing staff in an acute care setting according to their expertise and qualifications. The next one is the evidence-based practice. This is the provision of healthcare that incorporates the most current and valid research results. The next one is the family practice, which is the medical specialty of a family physician, which concern with the planning and provision of comprehensive primary health care regardless of age or sex on a continuing basis, also called as a family medicine. The last one is the general practice, which is an old term for comprehensive medical care regardless of age of the patient or presence of a condition that may require the services of a specialist. This term has now largely been replaced by the term family practice. So that's all for my report. Thank you and God bless.